Welcome, everyone, to another episode of Fusionary Health Podcast. I'm so excited to have you here. This podcast is where we share with health practitioners about what they do, how they do it, and all the different approaches that we can take to vibrant health. So my guest today is Dr. Monica Shah. She's a Tampa-based rheumatologist and former Miss India, Florida, turned fashion model and public figure. Dr. Monica Shah's purpose is driven by her passion for making a positive impact. As a 5-star rated physician, she has transformed the health of her patients battling autoimmune diseases. She says, "I am my patient's biggest advocate." Dr. Shah prides herself on her patient relationships, forging a bond based on trust, honesty, and knowledge. She individualizes the care of each patient, incorporating the latest scientific breakthroughs, but also educating on the importance of lifestyle choices. Multifaceted, Dr. Shah is also a current fashion model and previous winner of Miss India, Florida, and first runner-up of Miss India, USA. She says, "I want my journey to empower women on their infinite potential." She uses her social media platform to educate followers on her work in the medical field while discussing lifestyle and self-improvement topics. "I'm excited to continue to help and inspire my community," is what she shares. So welcome, Dr. Monica. I'm so excited to have you today.
Thank you. I feel like this is a long time in the works, so I'm excited to be here.
Yes, for sure. And you know what? I don't get to talk to very many rheumatologists, but I'm obsessed with autoimmune conditions and what they mean for us in this life and how we're going to battle them going forward and why are they so prevalent. So as a total nerd, I'm so excited to interview you today.
Yeah, I'm excited to share about what we do. I feel like it's a big unknown, and I'm excited to kind of shed light into what we do as rheumatologists and how we can help a lot of the people out there that probably think that they need us.
Absolutely. So let's dive in. Will you share what is rheumatology, what your aspect of medicine, what your field of medicine covers? What are some of the things you see the most? Let's just start there because I've met a lot of people who don't know the difference between MD and DO. I've met people who have no idea rheumatology exists. And we'll even dive in later into this conversation around what are the symptoms of an autoimmune condition and the things you're talking about and why they should come see you. So first, kind of give us that overarching picture.
Yeah. So rheumatologists are an extension of internal medicine physicians. So we've all been trained in internal medicine. So we work throughout the body. We know about all the organ systems, but the niche of rheumatology is we dive into autoimmune diseases. And so people are like, what are autoimmune diseases? These are systemic, so body-wide inflammatory conditions where there should be inflammation attacking healthy joints. And that's normally not supposed to happen. So we deal with not only musculoskeletal issues like rheumatoid arthritis and gout, but we also deal with more of the bone conditions like osteoporosis and osteoarthritis as well. So we work on the compass of musculoskeletal bone and joint diseases. And so common conditions you ask are rheumatoid arthritis, bread and butter. Osteoarthritis, osteoporosis. We deal with systemic lupus. We deal with psoriasis and psoriatic arthritis. So we have a very broad scope. And in fact, I don't think many people know that rheumatologists treat over 100 autoimmune conditions.
Wow.
So the breadth of knowledge and the scope of our practice is very broad, although we are very niche.
Sure. Absolutely. Over 100 different ones. That's crazy.
Yeah. I know. And some of them, you read about in books you don't see, but there is that one-off case that, it's like, wow, I read about this years ago and you're finally seeing it in a patient presentation. So I think the big myth with autoimmune disease or arthritis, as people like to call it, as the arthritis doctor, is that, it's only supposed to affect the elderly. And everyone's like, oh, we don't need to see an arthritis doctor. I'm so young. I'm 30. I'm 15. And that's the big myth that I like to break to a lot of people is that we deal with patients as young as 15 all the way up to, 90 plus. So, autoimmune diseases aren't just directed towards the elderly. It's important to know that the younger population can also be affected by these conditions.
Absolutely. I mean, psoriasis, all these kinds of things, I think we're seeing in younger and younger ages now, anyways. Like there's a prevalence of autoimmune moving into the younger generations. So you named a lot of the diseases. Will you kind of talk about what are some of the symptoms of these
Sure.
main issues? And will you name some of the ones that are more common now post pandemic that you're seeing a lot more that maybe you weren't seeing before? So, for example, I have someone on my team and she got Sjogren's after pandemic, and she's
Mhm.
not sure what caused it, what kicked it off. Could be, a number of factors. But now she's struggling with Sjogren's, so she has to be really tightly regulated by rheumatology. It has other effects, so she has to see the eye doctor and other things very regularly. So, is there certain things you're seeing a lot more of, and then what are those symptoms that a lot of times people, because I love talking about inflammation,
Yeah.
sometimes people are like, oh, I'm aging. Like my friends will say, I'm really aging. I'm fatigued and I'm tired and I'm stiff in the morning and my joints hurt and I've got brain fog. And I'm like, these are called constellation of symptoms that could add to autoimmune, you guys. Come on.
Yes.
So will you
Yes.
speak into that?
Sure. So the breadth of autoimmune diseases, the spectrum of symptoms is so vast. But what I see more and more of as time has gone on and I've been out in practice is fatigue. Everyone's like, I'm tired all the time. Nothing has changed. I've lived the same lifestyle, but now I'm tired. So fatigue is almost like that first step in the door where there could be some evidence of something more going on. Like you said, it's a constellation of symptoms. So it starts off as something as basic as fatigue that people tend to blow off. Oh, I'm overdoing it. I've overworked. I'm stressed out with my job. But then it kind of, cascades into other things. They can start having joint pains, like you kind of talked about with your friends. They can start having limitations in their activities of daily living. I used to be able to do that, but now I can't because it hurts a little bit, or I pay for it quite after. They can have warmth in their joints. So they can have rashes of some sorts. So the constellation of symptoms is vast and broad. And that's really what our patient encounter really goes into is we deep dive into what symptoms are you experiencing, and we try to put the pieces together because those clues are what help us direct our lab testing and our physical exam to see, okay, well, this is, these fall into this category. It could be that we're dealing more of a lupus picture than a rheumatoid arthritis. So it gets a lot into a lot of our patient encounters we spend a lot of time with history and physical exam. So we spend, at least an hour in a rheumatologist's office. We're asking you things that I think other doctors may not. And, I hear that a lot. They're like, wow, no one's ever asked me that question, or I didn't ever think about that. Maybe that is due to something I've been dealing with as of recent. So we try to put the pieces of the puzzle together. And that's a lot of what rheumatology is. It's a lot of deep diving, a lot of digging, and putting pieces of the puzzle together. Now, you asked, since COVID, what has been shown up with a lot of the patients that have been coming in? I've seen a lot of patients come in just for abnormal labs. So a lot of doctors, when you go to their primary, they say, oh, I'm having joint pain, I'm having fatigue. And the doctor's immediately triggered to order blood work. Really, part of that blood work is something called an ANA, an anti-nuclear antibody. And this is a non-specific blood marker for autoimmune disease. And so typically 20 to 30% of the general population will generate an ANA, whether they have symptoms or not. So that's something to keep in mind. It is non-specific. So it doesn't tell me, okay, this is a rheumatic autoimmune, this is a thyroid autoimmune. But they usually come in, the next step is you've got to see the rheumatologist. So I've been seeing a lot of patients with a positive ANA and non-specific symptoms. And I have, there isn't any data out, there aren't any studies out, but I was, inquiring, and that's something that's been a conversation amongst a lot of rheumatologists is what is the precedence of an ANA since COVID? And I think that the vaccine, the actual virus itself can trigger this auto antibody. But the things to understand is the antibody itself is not the form of diagnosis. It's just a clue. So that's what I'm seeing a lot of abnormal labs and a lot of fatigue. And then that's really where our work starts. I mean, we go in, we do the physical exam, and that's kind of what we open our doors to figure out what are the appropriate lab testing to help guide us. Now, we use labs as guidance, not diagnostics.
Sure. So from there, someone goes to primary care, they're fatigued, like you said, they do that blood work, it's red flagged as, hey, they should go see rheumatology.
Mm-hmm.
You're saying you sit down with them, and then are you able, my understanding is, can you go into like the blood work that you order that
Sure.
then helps you narrow it down into what those issues are?
Yeah, so it'll depend, this is all what we like to call rheumatology is also very like individualized medicine because every patient profile is going to be different. We take into account age, sex, and also lifestyle factors. Are they smokers? Do they drink? What kind of lifestyle do they live? All of these things are clues for us to figure out, okay, what path are we taking in terms of their medical examination and further lab testing and even imaging for that matter. So for my younger patients, we have a lot of patients come in that are in their young 20s, early 20s, and they're premenopausal. So that also takes into account what we should be looking out for. They can say they something like, I've been having fatigue, I've been having hair loss, I've been having these rashes when I go out in the sun, they're photosensitive rashes. I've noticed my joints hurt. Now, for the average young female, that should not be the case. These are not normal symptoms. A lot of patients ask, is it normal for me to feel this way? Absolutely not. With nothing else changing and no other factors that you're aware of triggering all of this, that is my first clue. So we do a full physical exam. The ANA in this instance is part of my workup because the ANA is kind of the first foot in the door for a lot of these autoimmune conditions. Now, the big take home is this autoantibody, this positive ANA, what other autoantibodies are they associated with? And those are the clues that we're looking for. Sure. So for someone, like you said, your colleague with Sjogren's, they have specific autoantibodies that are corresponding to Sjogren's disease. Then you have specific autoantibodies like a double-stranded DNA. That are associated with lupus. So we kind of pick and choose what we think is going to help guide us and what will make the most sense. Now, these are resources, so we try not to waste them. We can order every test under the sun, and there are panels available for that. But we really try to tailor our approach to figuring out, okay, these are the autoantibodies for Sjogren's, for example, would be an SSA and an SSB antibody. These autoantibodies are clues to help guide us. Okay, these autoantibodies are positive. They're most commonly associated with Sjogren's. You have dry eyes and dry mouth, for example, and you have some joint pains. This all fits this clinical picture. So more likely than not, we are possibly dealing with Sjogren's. And that's kind of how we approach our care and how we analyze these labs and what we decide to do next.
Got it. And so when you do sit down with that patient, it can be pretty devastating that they get diagnosed with something. I'm sure they had some indication on the inside that like, hey, something's wrong, but still to get a diagnosis always sucks. It's not something you really want. So how do you kind of guide your patients on not just the medications in the toolkit that you have there to help them with their symptoms and supporting them?
Sure.
But the natural side, like what is the lifestyle and the anti-inflammatory, like how do you guide your patients on both sides of the spectrum so that they have the best toolkit possible?
So I like to, that's a great question. And that's a lot of what I pride myself in doing. I think this is the most pivotal part of the conversation as a doctor that treats autoimmune disease and something you can relate to personally with your product. But I like to split it up in terms of wellness and health. So wellness, I think about it, and this is what I tell my patients, wellness is the active process through which people make choices to have a more successful existence, if that makes sense. These are the active things that we're doing. We talk about health and wellness. And then I talk about health. So health is the actual goal. That's where you have a complete state of physical and mental well-being. So I say that wellness is the active process of achieving health. So I like to split it up like that. And so then we do a little deep dive. And a lot of my education is spent on not only, like you said, the medications that are out there for these conditions, but also what they can do at home. And a lot of the patients are like, what can I do? How can I help me? And I think that is a very important question that every patient should be asking themselves. They have to look in the mirror and say, what am I doing to probably contribute to these conditions, this inflammation that I'm dealing with? And we start with the diet portion of it. It's very important to have the knowledge of pro and anti-inflammatory foods. So there is a nice little packet that our office has, I put together essentially that goes into foods that are pro anti-inflammatory, foods that are anti-inflammatory. And I think that's the real key off here, is that importance and take home. We talk about fruits, we talk about vegetables, we talk about whole grains, we talk about fiber, we talk about all of it. And I think that, understanding, it's like going back to grade school and you're figuring out your plate. And it's like you do a half a cup or half a plate of fruits and veggies, a half a cup of protein and half a cup of grains. And I think it goes back to the things we were taught as children that we tend to forget as time goes on. And then the other aspect of it is really alcohol intake, limiting alcohol intake. If they smoke, we know that smoking is a risk factor for autoimmune disease. We know that for a fact. And then we talk about exercise and physical activity, and how that is important in keeping your joints mobile, active, lubricated, et cetera. So I think there is a host of ways that we have to touch on this. And it's not just focusing on one part of it, but we have a multimodal approach here.
Sure. And when you do sit down, I've met certain doctors who are like, I'm going to tell my patient that they need to lose weight, eat healthy, eat anti-inflammatory, and do the things, but my patient's not going to listen. Like I've heard that said about my father-in-law once. I took him to primary care and the primary care doctor's like, well, he's not going to change anything. And I was like, you cannot have that attitude. You have to hold the hope that there's potentiality here. I know you have to mitigate the risk. I know that why we're getting him on prescriptions to preserve heart health and all those things. But when it comes to your patients, do you have any patient stories where, you had a patient come in and you shared with them what you're talking about, really opened up that light bulb of what's possible for them, and then they did the work and were able to completely turn around this condition that a lot of people just live with, but, they were able to make that change?
Absolutely. I can count on 5 hands how many times this has happened. And that's why I spend so much time doing this for my patients, is I've seen cause and effect. We do the work, we talk about the education, and we see the difference. I've seen it ranging from patients with rheumatoid arthritis that have been chronic smokers. They eat a poor diet with, high in fast foods, high in high fats, high in triglycerides, et cetera, red meats, things like that. So pro-inflammatory foods, I've seen it myself. And then they live a very sedentary life. I mean, working out is just not part of the routine. Working out for them is I run around the house and I do chores, so I'm active. And that we kind of have to separate that as well. So I've seen patients with rheumatoid arthritis that are so motivated by not wanting to be on medication. And I understand that, because we are not here to push pills. We say the medications are there to help a lot of the symptoms, but the inflammation going on in the background, you can do something about. So I've seen patients actually reduce the amount of medication they've been on through their lifestyle changes. So not only in the autoimmune conditions like rheumatoid arthritis, but also in conditions such as fibromyalgia that I treat, and that's, there's taboo with fibromyalgia.
Sure.
And there's, a negative kind of sense about, okay, this is what fibromyalgia is. It's not real.
Right.
And a lot of people don't think it's real because there's no blood test for it.
Sure.
But it is a pro-inflammatory condition where patients have 180 their lifestyle, and they've gone on to be medication free and almost, have symptom free living. So I am passionate about it because I know it can work.
Sure. That's a big deal. I mean, let's talk about it for a second, because people might not even know, but fibromyalgia is considered a kitchen sink problem.
Yes. Yeah. Like we don't know what it is. It's fibromyalgia.
Yeah. So I think it's called a syndrome, but not a disease. It's just, and anytime they find a woman who they think is melodramatic or histrionic is a word I hear a lot, or, she has no idea what's wrong with her, but she just has a lot of complaints. Oh, it's fibromyalgia. Let's keep moving her on to the next person who wants to deal with it. So I find rheumatology sometimes is holding the bag in the end with patients who are like, look, I don't know what to do. Like I'm at my last door here. No one's believing me when it comes to my constellation of symptoms, but they do exist. It's just really cool to see that you really, in a sense, are using your functional medicine as the approach of taking Western medicine and science-based solutions from the alternative modalities, putting them together and offering them to the patient in that very holistic way. So it sounds like you're bringing that into your practice.
Yes. And that's, exactly what you said. Conditions like fibromyalgia are dismissed. They have a negative connotation to it. And patients are often led to believe, because of the social impact of what they've heard or just chit chatter on the outside, that it's not real or nobody knows what's wrong with you. So they just told you it's that. But fibromyalgia is a diagnosis of exclusion. So we did the work. We did the blood testing. We did the physical exam. We did any imaging necessary to rule out other causes for pain and discomfort and fatigue, for example. Sure. And when it boils down to it, if the physical exam fits and the symptoms align, we call it what it is. And that in itself, the great thing about fibromyalgia is it's not autoimmune. So it's not inherited or can nor be passed down.
Okay.
So, patients are like, oh, my mom has it. It's not really your mom passing it down to you, but it may be a time to look in the mirror. What lifestyle change, what lifestyle did my mother live in? What lifestyle am I living? And is that passed down? Those behaviors, those mannerisms, those lifestyle choices in terms of diet and physical activity. So it's a lot of introspective work for the patient. And I tell them that. But, looking out for my patient, especially the younger females that come in that I diagnose with fibromyalgia. Who wants to be on 3 pills at the age of 30 or 40, And so I really think about, if they do the work on the front, on their end, then whatever is left, whatever is still lingering, whatever we can then treat, I feel is the most appropriate approach. Nice. Because people still may need medication for underlying, anxiety, depression, things like that fibromyalgia also encompasses. But if they do the work in terms of, I've really put my head down and I focused on these lifestyle changes and I know I feel better, but I still have XYZ, well, that's okay. We can still help you and we can still treat you. So it's, it's not the end of the road, as I feel some people come to me with lost hope.
Sure. And then they can get that hope back, which is a big deal.
Yes. I think that's the biggest reward of my job is seeing patients be like, wow, no one else believed me. And now I feel better. And it's, you took the time to educate me. Half of it is educating. If people just spent the time educating their patients, I think a lot of miscommunication would be, fixed, and a lot of realistic expectations are set for the patient. Sure. And that, I think, is the big take home message for what I've learned in the last, 2 years out is, if you spend the time educating the patient, they are now equipped with the knowledge they did not have before to make the choices to better their life.
Sure.
And as physicians, we should be doing that. Our job is not only to, give them medication. We did this and we trained for a purpose.
Right.
So that's how I approach it.
I love it. I love your perspective on it, because oftentimes the way medicine's set up is the practitioners don't have the time. Yes. A lot of the physicians who I work with who carry my product, there's like a 5 to 7 minute window, and
here's it
booked in, and it's your non-surgical day and you've got to jam it in there. Mm-hmm. And so I sympathize. It's the system. It's the only way that those practices break even. Like, that's the business side of it. But what's interesting is you're saying in rheumatology, the system has designed it that you have to dig in. You're a detective. Mm-hmm. You're going to need the time to look at the entire picture and get enough information to decipher, okay, I think that this is the one we're talking about here, and I'm going to confirm it with lab work and imaging. So because you have the time, you also have some built-in time, if you want to dive into education.
Yeah. And I don't want to say the system is that way. I want to say my system is that way, because I can't speak for other practitioners, because these patients have come from other practitioners that do what I do and did not get that education that they needed. And for me, spending that extra 10 minutes, this isn't a breath conversation. This is multiple visits over the course of a few months. But even spending the extra 10 minutes on that initial visit sets you up for success in the long term, where, efficiency is still has to be a part of the practice. And you're right. This is the way medicine works, is you have to see patients, you have to, see new ones, see follow-ups, change treatment, and you only are allotted a certain amount of time. But that extra 10 minutes is maybe all it takes for the future visits to be more efficient and to get through to the patient. So I take those first visits very heavily, and I spend that extra time needed in those initial first 1 or 2 visits to really get that patient to understand, okay, this is our expectation working together, what we're trying to achieve. And, as long as you're doing your part and I do my part, then I think we'll turn the corner and we'll see a change. But, we get the beauty, and I can speak for rheumatologists, being a non-surgical field, we have the outpatient time in the office. Our full breadth of our practice is outpatient. So we don't have we don't have surgical days where we're out of the office fully. So we do get a lot of our time is in the office. I mean, if we're seeing consults in the hospital, that's an outlier, but a lot of our education comes in that exam room. To each their own in terms of rheumatologists, because everyone has a different approach to the way they practice medicine and how they want to run their ship. But that's something that, at least for me personally, individualizing care to my patients is what I know is what's going to turn out best for both of us.
Sure. And you mentioned thyroid autoimmune. So
Sure.
many women who I meet are suffering with thyroid conditions, subclinical thyroid conditions before they become full blown.
Mhm.
I thought everyone's supposed to go to endocrinology. So where is that line, or how do you differentiate which way the patient should go?
Yeah. So the ANA can also be, we talked about this positive ANA. And part of the testing for something that we do is we also look at autoimmune thyroid autoantibodies. Okay. So we're still looking at thyroid autoantibodies to see if this ANA, like we said, we're trying to figure out what blood tests are associated with this ANA. Are they Sjogren's? Are they lupus? Are they rheumatoid? So we also include, oftentimes, if the symptoms are compelling enough, thyroid autoantibodies. And we still do recommend they see the endocrinologist. We're not putting them on thyroid medication or treatment or managing those things. But I always tell my patients, a lot of the thyroid conditions, so hypothyroidism, for example, Hashimoto's thyroid, which is the autoimmune version of hypothyroid, those symptoms overlap with a lot of other rheumatic autoimmune conditions, the fatigue, the joint aches, hair loss, sores in the mouth, rashes. A lot of the stuff can overlap. So that's why we like to unmuddy the waters, as I like to say, and figure out, okay, are we dealing with 2 autoimmune diseases that have overlapping symptoms? Or are we dealing with an autoimmune thyroid condition that, once this is fixed, we can, then decipher if there is a truly rheumatic condition also contributing. So it's like detective work for sure, but we definitely, approach and work with a lot of other subspecialists. With endocrinology, we work with pulmonology, we work with cardiology, we work with hematology. So, this is why internal medicine is a big part of what we do. Is we not only practice in it to get to where we are, but we still utilize those other subspecialists to help treat our patients, because we're dealing with conditions that impact the whole body.
Sure. It's going to affect all symptoms of the body.
Yes, absolutely.
Mm-hmm. Okay. I have another question. I meet a lot of patients out there who are like, I'm a rheumatoid arthritis patient and I don't want to take, and they'll name a drug like Humira or some of these bigger drugs that I'm perceiving to be expensive or a commitment. Can you explain a little bit what that's about? Because a lot of them are like, I don't want to be on that. And then they're willing to do all this work. I see.
Right. Yes.
Shift lifestyle. So there's side effects that are not great, or what are those issues?
Yeah. So, Humira, for example, since you mentioned it, is in a class of medications we call TNF inhibitors. And we know that TNF is a pro-inflammatory marker. It's in the cascade. So we're trying to block it. So we know that's active in rheumatoid arthritis, high in rheumatoid arthritis. So we're trying to block that receptor to mitigate some of those symptoms. So Humira isn't a biologic. We call it a biologic. You see the commercials on TV. It's a beautiful woman running through the field. She's joint pain free or psoriasis free, and everything looks great. And you're like, I want to be her. And then, the end of commercial, they're blabbering off real fast, all the side effects and all the risks and all of that. That is one of the most common things that I deal with also is, hey, I read about it, or I saw it on a patient blog. They're talking about side effects ranging from infection to cancer to, a GI upset. So the range is broad. And if it happened to one patient in a clinical trial, they by law have to put it in the package insert. So you'll read about it enough and it'll scare you off.
Sure.
And the way I approach that is we still talk about the lifestyle changes, and they are motivated to do that. But at some point, this is a immune dysregulation. Let's talk about rheumatoid, for example, since we're on the subject of Humira. Yeah. Rheumatoid is a dysregulation of the immune system. There is pro-inflammatory cytokines running through your body, wreaking havoc on not only your joints, but your organs. We talked about heart. We talked about lungs. And in fact, if it's bad enough, it could also be eating away at the bones, causing erosions, which we can see on X-ray. So this is wreaking havoc internally, and patients are like, yeah, I'm motivated to make the changes. Please continue to make those lifestyle changes. But at a certain point, we have to block this pathway.
Right.
And we individualized care. We pick the right drug for the patient. And there are over 20 plus biologics now. We have a breadth of medications. Yes. And then the other thing is expense. How much is it going to cost me? And this is unfortunately one of the other bigger issues we also deal with in a $1 billion industry, that is the insurance and pharma. These medications can cost hundreds of thousands of dollars to patients. And the sad part is I don't have the answer to how much is it going to cost me. We say, okay, let's go. We'll have to run it through your insurance benefits. The beauty about this is that all of these big manufacturers, AbbVie, Amgen, GSK, they all have patient assistance programs. So my goal for the patient is not to focus on cost. We have a way to figure that out. They all have patient assistance, financial support, et cetera. So my goal is not for patients to figure out and focus on the finances. Focus on the lifestyle changes. We tailor the medication to you. I look at you, I say, you have XYZ as underlying comorbid conditions. Do you have heart disease? Do you have a history of cancer? Do you have liver disease? All of these play a factor into what drug I'm going to choose for you. Mm-hmm. So there's a rhyme and reason as to why we recommend certain things. Yeah. But, the take home message is that the lifestyle choices are going to play a packed into the physical well-being and the mental well-being of your disease journey, I should say. But there is underlying inflammatory dysregulation that needs to be controlled, and that can only be done with medication. And that's when we take that approach of risk and benefits, and we have all the conversations.
Got it. So it really is a multifaceted, individualized, personalized conversation of, look, we've got to stop something in its tracks. So because we have to bring in something that we know is going to drop the hammer on it and really shut that down. And then and I see that a lot. It's really the whole point of this podcast is I am very Eastern in my thinking, but I'm very respectful of the power of the Western solutions as well. I share all the time. I've had different surgeries. I've had different interventions. Mm-hmm. Usually in my case, it's after trying every single door and solution that exists. That's natural.
Sure. And that's okay.
All right, I didn't win. I tried.
We're opening this door.
Yeah, I'm just going to have to switch over to the other side. And the other side has a solution called a fibroidectomy or whatever it is. Sure. And that solution solves the problem. And then I can go back to my merry way of living a lifestyle that will hopefully prevent that problem from ever happening again.
Yes.
And that's where we have so much power is,
yes.
Hey, I took the solution. I've seen this with my friend who has Sjogren's. She had to take steroids. And she was like, I wish I didn't have to. I said, you know what? Take the solution. And then let's go and look at the lifestyle again and what shifts have to happen to not have to go to that door again. But at least, you have a door you can open to solve the problem.
And I think that's where I think a lot of the education also comes in is patients come in and they're like, I've tried this, I've tried that, or they're coming to me wanting an answer, but not wanting the help of the solution I can offer. And And I understand that. I totally do. I am not here to push meds on anyone that does not want them. My job is to be,
people.
yeah, I'm like, this is what I recommend, but ultimately the decision is up to the patient. I can say everything about what I know and what I'm trained to know and what I think is in the patient's best interest. And I think, you talked about longevity of medication and is this something forever? I have had patients that we have, ultimately put into remission. That is our goal, to not even know you have the disease anymore. Like you are back to doing, I had a patient that was like, I just want to play tennis again. And they're back to playing tennis. Now they're cycling, they're doing everything. And they weren't able to do that before we had started them on these medications. And, they've been feeling so good for, 5-10 years at this point, several years of just consistently good, flare-free living. And they're like, can we start to scale back? And at that point, those conversations are appropriate. It is okay to try to scale back at that point and see, okay, let's try to wean down. And instead of, taking it every week, let's go every other week and see how you do and see if you try to reflare, your body's just not okay with it. And the body is so smart. The body will tell you whether it is okay or it is not, whether this flare is going to happen or it's not. And I think we have to be very intuitive in this field. Also, listen to our body. If it's telling you when it's not okay.
Sure.
And maybe that is a sign that, I need to be on this medication and I need to stay on it for the betterment of my life.
Sure. And so in rheumatology, you use the word remission. A lot of these autoimmune conditions, is it like cancer where it's something considered to be put in remission? Or are there certain ones where you can say without a doubt, okay, we cured it. We never expect to see that patient again. Like, do you look at the blood work and say, okay, that's perfect blood work. Somehow we got there. We're done with you. Let us know if you have a problem in the future.
Unfortunately, no.
Okay.
I wish it was that easy. I know the long and short of the answer is no. We have scientific breakthroughs, which is why I love the field. I mean, we have so much to offer now with so many different pathways. The downside to also what we do is that there is no cure. So our ultimate goal as rheumatologists is remission. You live your life on medication, disease free. You no longer feel like you have it. You can do all the activities. You can live your life, paint, bike ride, etc. No flare-ups, no joint pains, etc. I mean, that is the ultimate goal. So we follow blood work, absolutely, especially while they're on medication and treatment. But we also, a lot of rheumatologists do these scoring sheets, which is called a CDI. And it's basically a chart review that the patient fills out on. Oh, am I able to walk up the stairs with how much pain? Am I able to, hold a coffee cup? How much pain have I been in over the last week, et cetera? And it's a scale from 0 to 10. And they fill out all the form. Every visit that I see them, they fill one out. And 0 is remission for me. And then I do my physical exam and I palpate all the joints and they're like, is it tender, swollen? We ask all the questions, nothing. You are in remission. You are doing so well on your therapy. Your therapy got you to this point. So I have to remind my patients of that too. They're like, well, I feel great. Can I stop it? And I was like, wait a minute. Something helped you get here. And it was these medications. So remission is the ultimate goal. And that can be achieved not only through lifestyle changes, most importantly, but the medications that your rheumatologist recommends.
And then you can work with them as long as they're doing the lifestyle changes to taper down.
Yeah, if we have them in remission for X amount of years or whatnot, and they're doing so well, their labs are consistently solid, no flare-ups, no prednisone, nothing, then we have the conversation of, okay, if they're on 2 different therapies, what can we try to scale back on? What can we limit the use of? We have those conversations with certain patients that when it is appropriate, we will.
Cool. That's awesome.
Yeah. So
I did not even know
it changes every time. It changes every time.
That's so fascinating. It's really quite a management job. Like your patients are probably with you for a very long time.
Yes. And that's half of why I love rheumatology is that I wanted something where I had a patient-doctor relationship for the extended foreseeable future. I know these people are going to be in my lives for years, if not forever. And, after they're stabilized for a period of time, we're like, instead of every 3 months, let's push you out to every 4 months or every 6 months. So, once we get them stabilized, and those are those important initial handful of visits in the beginning. Yeah. Then once we got you controlled, we at least know what's working. Let's see how you do over 4 months instead of seeing you as soon as we have been seeing you. So everything changes on a daily visit with these people. Every visit is different for every patient.
And then you mentioned osteoarthritis. I'm curious because I deal a lot with orthopedics, chiropractic. The question I want to ask is who's best suited to deal with osteoarthritis, which is not the best way to ask it, but how do you approach osteoarthritis and how is that maybe different than orthopedics?
Yeah. So orthopedics works with osteoarthritis and so do rheumatologists. Okay. But I send my patients to orthopedics, or patients are seeing orthopedists when they need intervention done. So, their osteoarthritis has affected their knees and it's nearly bone on bone at this point and they need a knee replacement. Sure. Orthopedics it is. Or they have a torn rotator cuff and they need to be surgically, a surgical procedure needs to be done to help their symptoms. See the orthopedist. But from a conservative standpoint of patients that are just dealing with the bulk of osteoarthritis that need to be managed symptomatically, I tend to take over those patients and work with them to find, the best regimen for them in terms of therapy, however that is. So we rely on a lot of our orthopedists for those intervention measures. Yeah. But we also, as rheumatologists, can do procedures such as intra-articular, like steroid injections. Okay. So we don't have to send them to the orthopedist for things like that.
Okay. Got it. And so let me ask this question. Many who listen to this podcast know I'm the founder of Fusionary Formulas. And I know when we connected online, you were like, yes, I am definitely open to recommending turmeric to my patients. Will you talk a little bit about your perspective on turmeric and natural solutions like these for your patients?
Yes. So, we grew up in the Indian household and it's been around forever and it's in all the food that we eat and moms told us about it. And it, being around as long as it has been, we know that it's part of the healing process, at least from what we've been known through medicine in India. But being in the Western culture and trying to adapting that into patient care now, and as a physician, what's interesting is I did a PubMed search on curcumin and inflammation and autoimmune disease as I was, starting my career. And I was like, what else can I do to help my patients? What else can I tell them? And there have been numerous studies. I think there was like 500 articles out on autoimmune disease and curcumin and its impact. So people have done these vetted studies and you can probably even elaborate on that, but they've done numerous studies and I've seen like 20 plus on OA, osteoarthritis. They've done it on patients with Crohn's, on type 2 diabetes. So these are all autoimmune conditions. And we know that there are pathways that are pro-inflammatory. We know there are certain cytokines that are pro-inflammatory in these chronic inflammatory states. And curcumin almost works like it is an anti-inflammatory. It works on the same pathway that you would take a Celebrex or an Advil or an Aleve. It works on that same pathway, but you're not having to deal with the symptoms of side effect now of gastrointestinal or gastritis or even stomach ulcers. You're not even dealing with those side effects now, and you're finding a natural approach to working on these pro-inflammatory cytokines. So seeing being medicine brained and nerdy. And I'm like, what's the data? I'm always like, what's the data? What are scientific studies telling us? And in a lot of these conditions, they put patients on, curcumin being the most potent active, ingredient of turmeric. Really, that's really the magic in there. Is that these patients are now, like with osteoarthritis, walking faster or walking longer, or their joint pain has subsided. And for Crohn's, their gut has almost like their microbiome has shifted and they're not having this pro-inflammatory response and they're having better absorption of their food and their vitamins. So like it was remarkable for me to see early on in my career. And then you come along and I'm like, oh my gosh, say less, because especially with how I approach my patients with their lifestyle, this was just something that that was, kind of meant to be. I needed to implement this to help these people out in another way that, there are patients that are, I'm not keen on taking meds, and I get it. We're not here to push meds on you. And if there is a natural approach, I will be happy to share it with you.
I love that. Thank you. You said everything that I would say.
Okay, good. I did it right.
Yeah, but out of a practitioner's mouth, which is so refreshing to me. My whole goal is curcumin is a powerhouse. It's so well received by the body. It is so powerful for those inflammatory pathways. And so much of what we're dealing with in medicine is inflammation based across the subspecialties. And so it feels like a very lifelong journey that I've decided for myself to get this mission out there that, look, just offer a natural alternative alongside the solution you're going to offer. Because the solution you're going to offer, we know it works.
Sure.
But this also is a natural alternative that works too. And it just depends on the degree to which the patient can get the support they need. And maybe they can make the switch to natural. Especially we've seen it with the joint pain, chronic joint pain patients that you're talking about with OA. It's like, wow, they can walk, they can run, they can walk up the stairs again. So to me, it's such a powerful thing when when we can add it to the lifestyle changes. One thing I realized was people start taking curcumin. They're like, I've got a pill for my problem. And I was like, no, that was not the intention.
That was not the, yeah, I get it.
Make the lifestyle shifts. And this is the perfect symbiotic solution with it.
Of course. And it's funny you say that because I've had patients say, I started taking turmeric and I feel better. Do I need to take anything else? And that's patient individualized again. If we're dealing with osteoarthritis and you feel fine on turmeric, all the power to you. Keep going, keep mobile, keep active, make sure you're still having that dietary importance and precedence there. But you don't need to take Advil. You don't need to take Aleve, and that's really the ultimate goal is less is more is what I like to say. And the less medication you need, the better.
Absolutely. Absolutely. So let's dive into this conversation a little differently.
Okay.
You are not only a physician who does rheumatology, you've competed in these different things. You have this platform where you share, you've done Miss India, USA competitions and things like that. What is that greater message that you're hoping to share with the world by doing those other things outside of medicine?
Yeah. It was an unexpected, pleasant surprise, but something to do to shift me out of my comfort zone and say that I did something different. But I think that the main take home that I learned through all that is that we have infinite potential. We are capable of so much more than our fears limit us to. And a big thing for me was the fear of doing it. I think I was like, I needed to do something to say that I tried something different. And I was so scared. I mean, it was so out of my comfort zone. It was something that I never even dreamed of doing it. I didn't grow up a pageant girl. Sundays are like football Sundays. So this is just so out of the blue for me. But for me, I was like, if I could say I did something and I did my best and I tried, it's just a memory and it's an experience. And there's something to learn from all of these experiences individualized. So I took it as a learning process, but I also took it as, okay, you're doing something different. You're challenging yourself. You're going to grow from this. And I think that was really the thing that opened my eyes to like, wow, you're capable of so much more than your fears hold you back from. And I think that's what I've been doing more and more with that platform now is like showcasing, okay, like you can also fulfill all your other aspirations. I also wanted to be a doctor and I was in medical school when I did all of that. So I'm like, okay, we're just going to give this a go. Worst case scenario is nothing happens and you're still doing what you do and you tried this,
Sure.
But that hope and that spark of like, okay, if you just believe that you can and put in the work and the effort to make it happen and you can say you did your best, I think that's all that matters. And that really was beautiful to me because it gave me that second wind of confidence that I wasn't sure that I even had.
Absolutely.
I think that inspiring, for what I can, whoever I have and whoever I will continue to. And that's really my goal is knowing that you can still be a physician. You can still, do this this one thing that's a 180 from what you're doing in your other, your normal career. You can still be interested in fashion. You can have all these other hobbies and interests, and you are not limited to just being a physician. And everyone's like, what do you do for a living? And I'm like, well, what part do you want to know? It's just like, it's fun to be multifaceted, and people are, as human beings, we are multifaceted people. We don't belong in a box of, I just do this. And that's really my take home message. And that's what my Instagram's about. That's why I love doing these podcasts, is sharing not only what I do, but the impact that your life choices can make. You're inspiring someone out there to do something that they weren't sure they were able to do. And I think that's really the coolest part about all of this.
Sure. No, I totally agree with you. I did something along those lines a few years ago. I felt like I was being too complacent, like when you're told, hey, niche down. So I'm the turmeric girl, and my baby's turmeric. So I'm just going to talk about turmeric. Eventually I got bored. I was like, I just can't talk about turmeric 24/7. And so I expanded that, and I realized, you know what, actually, I'm going to take a year and call it the year of yes, and do everything that scares the crap out of me.
I love that.
It was the best year because
isn't it great?
It pushes you exactly hard against your own walls and your own comfort zones. And you have to break through. I mean, those breakthroughs can be so powerful. And then you bring that energy back into your work, because you're like, anything's possible. Anything's possible for you too in your health. If I can do it, you can do it. If everyone could just open their minds to possibility, then anything's possible.
I totally believe it. Absolutely. I couldn't agree more.
That's awesome. Well, it has been such a great honor to interview you today.
Thank you.
I've really enjoyed this. I love meeting a practitioner who gets it and fuses the two worlds. To me, that's fusionary, fusing the East and the West, fusing the lifestyle and the allopathic solutions together in a way that's holistic and brings the best solutions to the person who needs it most, which is the patients, the audience, the people out there who are looking for solutions for their health. So thank you.
Absolutely. It's been so fun. I mean, I love your product. I love what you're doing. I love the message, and anything or anyone that's, benefited from our conversation. I'm grateful. Definitely.
Please share how they can find you, your website, your Instagram, all those ways.
So practice, I work at Gulf Coast Rheumatology. So if, you are in the Tampa Bay area or wanting to, see me as a rheumatologist, that's the best way. And then, social media is also a great way to get in touch with me for any questions. Obviously, medical related, we take with an air of caution and care. But if any way I can answer any questions or just say hello, I would love to hear from you. And my Instagram is dr.monica, MONI2ICA. So I'd love for everyone to just say hello, or if, you benefited the conversation, I'd love to know how. And so I can kind of continue to help other people. And I think that's ultimately just a full circle moment for me. So I love it.
Beautiful. Thank you so much for today. Thank you everyone who joined us here on the Fusionary Health Podcast. This podcast is for you. It's a way to show you new approaches, new mentalities, new mindsets, new practitioners and subspecialties that are ways that we can all approach our health and maintain our health to total vibrancy. Thank you to our sponsor, Fusionary Formulas. The website is fusionaryformulas.com, and reach out to us if you have any questions. And if you have a certain practitioner or health modality you want covered, reach out to us on the podcast, and I'd love to interview them as well. Thanks so much for joining us. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health Podcast this week. You have the power to transform your health and achieve vibrant health starting today.